Welcome to the Deep Dive. Today we're going to dig into some significant news. Former President Joe Biden's diagnosis. It's an aggressive form of prostate cancer. Our information is coming straight from a statement his personal office released. So our mission here is to, cut through the medical language. We want to give you the core understanding of this diagnosis, what it means, why it's important, without getting too bogged down.
Right. And what's really striking is, well, how quickly it all seemed to happen. Just last week, apparently, he went in because of some new urinary symptoms. That led pretty fast to finding a prostate nodule. And then by Friday, the confirmation, aggressive prostate cancer. And unfortunately, it spread to his bones, metastasis.
Okay, wow. So aggressive and spread to bones, that definitely sounds serious. The statement also brought up a Gleason score. A score of 9, grade group 5. For those of us listening, maybe without that medical background, what does a Gleason score actually tell us? How serious is a 9?
Well, think of it almost like a danger rating for the cancer cells.
Wow.
It's based on how abnormal they look under the microscope compared to normal prostate cells. A specialist, Dr. Davies, was quoted saying, a score of 9 indicates, well, the most aggressive form. So basically, the cells look very different, very abnormal, and they tend to grow and spread faster. A high score like 9 is, it's a clear indicator of...
Now, buried in that concerning news, there was a phrase, the cancer appears to be hormone sensitive. What's the significance of that? Is that a positive thing?
It is. Yeah, that's actually a really crucial piece of information, potentially quite positive. See, prostate cancer often uses hormones like testosterone as fuel to grow. So when it's called hormone sensitive, it means treatments that lower those hormone levels, like hormone therapy. They have a good chance of working. They can potentially slow the cancer down, maybe even shrink it. So even though it has spread, the sensitivity gives doctors a really important tool to manage the disease.
Okay, so that provides a pathway for treatment, even in this serious scenario. What happens next, then? The statement said Mr. Biden and his family are looking at options with his doctors.
Exactly. They're in that process now, reviewing the possibilities. And it's worth remembering, something a urologist, Dr. Brumhot, pointed out generally, prostate cancer itself is actually very common. Many men develop some cancer cells as they get older, but, and this is the key difference here, the fact that this cancer has spread to the bone. That's what makes it, as Dr. Davies put it, very serious and not curable. Not in the traditional sense of eliminating it completely.
That's a sobering reality, not curable.
Oh.
But Dr. Davies also mentioned some encouraging progress in managing these advanced cases.
Absolutely. That's the other side of the coin. He stressed that recent advancements, especially in hormonal therapies, but also chemotherapy, have shown really impressive results. They've significantly extended how long patients live, even with metastatic disease like this. So while a cure might be off the table, the goal becomes effective long-term management, keeping the cancer under control and maintaining quality of life.
And speaking of managing it, Dr. Brumhot mentioned the timeline for even deciding on a treatment plan.
Yeah, he suggested it could take, a few weeks to really map out the best direction. It's not an instant decision. And he also brought up a really vital point, considering the potential side effects. Some treatments can impact things like memory or mood, general quality of life, so there's a balance to strike. You need a thoughtful approach, not just attacking the cancer aggressively without considering the broader impact on the patient.
Right, that makes sense. It's about the whole person. Now, this news inevitably brings the focus back to Mr. Biden's age and health. This was obviously a huge topic during the 2024 campaign, given he was the oldest president ever.
It really was a constant point of discussion. And it definitely intensified after that debate performance in June 2024, the one against Donald Trump. That seemed to be a turning point, preceding his decision just a few weeks later to, exit the race.
It's quite a contrast when you think back to just a few months before that, February 2024. His physician, Dr. O'Connor, released a summary of his physical. It said there were no new concerns and declared him fit for duty. It really just shows how quickly health situations can evolve.
It really does. And there was more context that came out later. That book by Jake Tapper and Alex Thompson mentioned discussions happening among his aides back then about potential needs in a second term, maybe even needing a wheelchair sometimes. They also had that anecdote, remember, about him reportedly not recognizing George Clooney at a fundraiser around that same time, June 2024.
Though we should also mention that Mr. and Mrs. Biden addressed these sorts of concerns more recently, quite directly.
That's right. Just this past May 2025, they were on The View, and they both really pushed back hard against suggestions of cognitive decline. Mr. Biden said quite firmly, they are wrong. There is nothing to sustain that.
Mm.
And Jill Biden talked about his work ethic, how demanding his schedule still was, even post-presidency.
Okay, so let's shift gears slightly to the political reactions to this diagnosis. How has the news been received?
Well, perhaps somewhat surprisingly, given the history, Donald Trump, who, often criticized Mr. Biden's cognitive state, he put out a statement on Truth Social. It expressed sadness, extended well wishes to the family from him and Melania, and wished for a fast and successful recovery.
And Vice President Harris, she stepped into the nomination after he withdrew.
Yes, she also released a message of support. She called Mr. Biden a fighter, which is a term often associated with him, and expressed hope for a full and speedy recovery. We also saw similar sentiments, messages of support from former President Obama and Hillary Clinton.
Now, beyond the politics, there's a really significant personal dimension here for Mr. Biden regarding cancer, isn't there? This isn't just abstract for him.
Not at all. It's deeply, deeply personal. The death of his son, Beau Biden, from brain cancer back in 2015, that had a profound effect on him. You could see it. It clearly fueled his passion for fighting cancer, for advancing research and treatment.
And he took concrete action on that, even as vice president.
He did. President Obama actually tasked him back in 2016 with leading a major White House effort. The goal was essentially to accelerate progress towards curing cancer, a moonshot effort. And Mr. Biden spoke then about believing they could achieve big things.
That initiative continued into his own presidency, didn't it? The cancer moonshot was relaunched.
Yes. In 2022, he reestablished it with a very clear, very ambitious goal. The aim is to cut the cancer death rate by at least 50% over the next 25 years. He spoke about needing to mobilize the entire country, really feeling confident they could reach that goal. And it's telling that both Obama and Clinton, in their messages about his current diagnosis, specifically mentioned his long fight against cancer.
So, pulling it all together for you listening, former President Biden is facing a serious diagnosis, an aggressive prostate cancer that has spread to his bones. While it's termed not curable, the fact that it appears hormone-sensitive opens up significant treatment avenues. Advancements in recent years offer hope for effective long-term management. All of this unfolds, of course, against the backdrop of previous health discussions and his very public, very personal commitment to the cancer fight.
Exactly. And that really leads us to a final thought, something for you to consider. Given Mr. Biden's long and deeply personal history championing the fight against cancer, how might this personal battle now influence or maybe reshape the ongoing efforts? The public conversations around cancer research, around treatment discovery, and maybe even around how we view political leaders when they face their own serious health challenges.